Okay, so let's get this started. Good afternoon, everyone. Thank you for taking the time to join us for COVID-19, the Maryland Chamber's Response and Resource webinar presented by Maryland Chamber's Christine Ross, President and CEO, and Ashley Duckman, Vice President of Government Affairs. We are also honored to have Fiona Ong, partner at Shaw Rosenthal, and Matt Palmer, Deputy Legislative Officer with the Office of the Governor, join us today to assist with your questions. Please note that all lines will be on mute during today's call. We ask you to submit all questions in the chat located in the GoToMeeting dialog box. Upon submitting your questions, please ensure that you have selected everyone in the To field. We will answer as many questions as time allows and follow up via email with any questions that we are unable to address during today's webinar. Additionally, if you have questions following today's webinar, feel free to send them to mdchamber@mdchamber.org. Finally, GoToMeeting does offer webcam functionality. While our presenters will not enable their webcam, you may feel free to do so. Due to the large number of registrants, the amount of potential webcams in use may result in a distraction for you. In the event that you find the webcams to be distracting, you can easily disable them by using the drop-down arrow in the GoToMeeting viewer next to the camera icon and then selecting Disable All Webcams. Today's call will also be recorded and available on our website in the coming days. With that, I will hand it over to Christine Ross.
Thank you for joining us during this very trying time. The Maryland Chamber of Commerce remains steadfastly dedicated to supporting our state's business community throughout this unprecedented crisis. We greatly appreciate all the ways our members are stepping up and leading in the face of this crisis. It's during times like these that we are reminded of why the business community must have a unified and powerful voice in Maryland and in Washington, D.C., so that we can help guide our leaders as they make important decisions. There continues to be an overwhelming amount of information out there. Our staff is diligently working around the clock to compile resources from our partners and government agencies and other subject matter experts to convey them in real time to you, our members. During today's call, we are going to walk through the following topics. First, the current state of play of the virus nationally and in the state of Maryland. 2, resources available for Maryland's businesses. And 3, a summary of federal and state legislative responses. We will also have time for an open discussion to hear from all of you on the major challenges and concerns you are having. Our goal is to aggregate these and to be able to convey them in the almost daily conversations we are having with our agency's partners and policymakers. Now I'm going to turn this over to our Vice President of Government Affairs, Ashley Duckman, to take us through the agenda. Ashley?
Thank you, Christine, and hopefully you all can hear me okay. And if you can't, if you just drop it into the chat feature, that would be great, and I will continue to monitor it. We have just a lot of information to get through today, and I want to preface everything I'm about to throw at you by saying, to Christine's point, that there is just an inordinate amount of things coming at us by the minute, by the hour, by the day, and it is constantly changing, constantly evolving. We are going to limit our conversation today to an hour to be respectful of your time, and then we do want to have some time to dedicate to hearing your questions and understanding what your biggest challenges and concerns are at the moment. Again, to Marie's point, I just want to remind everyone that due to the sheer number of participants on the call and sort of the fact that we're all adjusting to working remotely, we're not going to be unmuting the lines. And so as questions come up, please submit them in the chat feature. And as I said, I'll continue to monitor them, and we'll try to get to as many as we can. And if we aren't able to get to them, please leave your email address, and I'll be sure to follow up with you after the fact as quickly as I can. So again, going to run through a lot of high-level information very quickly so that we can dedicate time to hearing from you. As Christine mentioned, sort of breaking our conversation into 3 distinct parts. 1, an overview of our current state of play. 2, state and federal administrative and legislative response to date. And lastly, an overview of business resources that exist. So as it relates to the current state of play, I mean, we're all watching the news, we're all seeing how this is evolving globally, nationally, and within our state. When we at the Chamber think about the landscape for the crisis and how it's unfolding, we really think about it in two separate categories. One is, of course, the public health impact and the impact to our communities, our employees. And then from our perspective, something we're very focused on, obviously, the economic impact to our country and to our state. So as it relates to public health impact, just a quick by the numbers, when we are monitoring that, we are clearly referencing the World Health Organization, the CDC, Maryland Department of Health for its guidance. The current by the numbers as of this morning, globally, approximately 335,000 cases, 15,000 deaths in 190 countries across the globe. Here in the US, we're looking at about 33,000 cases, 400 deaths, large concentrations, which are now being referred to as hotspots in big urban areas like New York and Los Angeles. Again, I'm not telling you anything you don't already know and haven't seen on the news. Here in Maryland, as of just minutes before this webinar, we were at 349 cases, and as I was sitting here, just got the news of another death, with that being up to 4, with the largest concentration of cases in Montgomery County. We are, very, very focused on what the near, mid, and long-term economic impact of this crisis is going to be on our state. And it is a gross understatement for me to say that it's already having very significant implications for our business communities here in Maryland. What we're learning through our partners that are experts in this space is that it really is still too early to determine what the real long-term impact is going to be on supply chains, on manufacturing, on the American economy. I know that given the importance of consumer spending to our economy, much of this will depend on the confidence of the American public moving into the future. But the one bright spot that we are being told by the experts that we're working with is we know that just 6 weeks ago, the economic picture was strong, and many of those underlying strengths remained into the last 2 weeks. Unemployment was at a 50-year low. We were experiencing strong wage growth, and there was record optimism among small businesses. So we started this from a very strong place. And we know that policymakers at all levels of government are working at warp speed, both here in Maryland and at the federal level, to attempt to mitigate the economic impact for businesses in our state. And so the bulk of my remarks are going to focus on what those policy proposals and laws have been that have been passed in recent weeks in response to addressing the economic crisis. I will say at the Maryland Chamber, we are very actively around the clock monitoring federal and state action seeking to address the challenges posed by the crisis. And what we want to do and the way we approach it is that we look at each to ensure that it appropriately balances public health and safety with the economic realities that employers and employees are facing at this time. To date, that has included in our outreach on your behalf to our governor and his administration to ensure that we do our best to keep as many businesses as possible operating, and I'll touch on that a little later in my remarks. Our advocacy has also included very, very regular outreach to our federal delegation and to our partners at the U.S. Chamber of Commerce to outline our concerns with some key issues in the federal proposals that have come forward. And I'll also touch on that in a second. So I'm gonna start with our state first. The governor, as you all know, has already taken a number of actions via executive order since declaring a state of emergency several weeks ago. And I know that Christine has shared this before, and I will echo her sentiment that we are grateful for the governor, his response, his incredible leadership during this very trying time. I mean, I think we're incredibly appreciative of his receiving our feedback and of his team really being a great resource to us and to the business community as we've all tried to figure out where we're going to land on this. But via executive order, since declaring that state of emergency several weeks ago, Governor has taken several distinct, concise actions, things like extending licensing deadlines, temporarily prohibiting the termination of residential services and evictions, loosening restrictions on all kinds of things, including alcoholic beverage delivery, in addition to all of the things being done relative to social distancing early on, including the closing of bars, restaurants, casinos, etc. I'm going to get to a lot more detail on other administrative actions taken by the governor, specifically as it relates to his announcement yesterday, when we get to the business resource portion of our webinar. The other thing that I wanted to mention from the state perspective is that in its days before adjourning sine die last Wednesday, the Maryland General Assembly passed legislation to address several of the then ongoing challenges posed by the virus. If you're looking for that legislation, it is Senate Bill 1080, the COVID-19 Public Health Emergency Protection Act of 2020, which authorizes the governor to take actions related to health insurance, Medicaid, retailer profits, employer actions, and personnel at state healthcare facilities. A full summary of that legislation, which we have done an analysis on, can be found on the resources page for our website. And I will pause there to say that you will hear me reference the Chamber's resource page many times throughout this webinar. Every single piece of information that we are collecting, big, small, talking sheets, talking points, frequently asked questions, links to other subject matter experts, all of that is being aggregated on our Chamber website. It is being maintained around the clock and kept up to date in real time. So if ever you have a specific question or you'd like more information on anything that I'm referencing during today's call, please visit that page and I'm sure you will find it there. If not, any member of our staff is standing and ready to be able to try to help answer your questions. So I will now move into a quick summary of what we know about what the federal government has done to date to address, again, mitigating some of this economic impact that we're seeing. Our biggest partner in our federal advocacy is the U.S. Chamber of Commerce. We are working with them and other experts and actively monitoring federal legislative efforts around the clock. So going back a couple of weeks, the federal government has sort of addressed this crisis in three phases. Phase one was a supplemental appropriations bill and was meant to be relief specific to public health measures. In the supplemental appropriations legislation, which totaled $8 billion, Congress and the White House agreed to provide additional funding for key agencies involved in addressing the pandemic, including the CDC, NIH, FDA, and others. It also included funds for the Small Business Administration to help administer $1 billion in loan subsidies. And I'm going to touch more on that later in the business resources portion of our conversation. Phase one was really designed to help new COVID-19 treatments, implement public health measures, and to attempt to slow and prevent the disease spread, and also to provide, as I mentioned, some early relief to ailing businesses. The second phase, which passed and was implemented last week, known as Phase 2, also known as the Families First Coronavirus Response Act, was focused on providing targeted relief for individuals, and it addressed several categories of policy. I will list them quickly, and then I'm going to dig into detail on a few that are of most significance to our membership. So the Phase 2 bill, Families First Coronavirus Response Act, addressed the following: unemployment compensation, paid sick leave, paid family and medical leave, provisions for diagnostic testing, health services, school nutrition programs, medical devices liability, and a discussion of liquidity impact for small businesses. I know there are going to be a lot of questions about the labor and employment implications on this bill, in particular paid sick leave and paid family and medical leave. It is why we have invited Fiona Ong from Shaw Rosenthal to join us on the call. I'm going to quickly go through just a few remarks on those two components of this bill. And then Maria, I'd ask that you also unmute Fiona in case she has any additional comments when I complete this section of the webinar. So as it relates to this bill, the bill number, by the way, in case you're looking for it, is HR 6201. Beginning April 2nd, this legislation will require employers with fewer than 500 employees, with some exceptions, to provide 12 weeks of protected leave to eligible employees who are unable to work, including telework, because of their child's school or place of care has been closed, or their child care provider is unavailable due to a public health emergency and other reasons. The new requirement amends the FMLA, and the 500 employee threshold under FMLA marks a significant change from the current threshold of 50 or more employers. So let me dig into it a little bit deeper. Any employee who has been employed for at least 30 days is eligible for the new leave entitlement under this act. This, again, is a significant change from the required 12-month minimum, 1,250 aggregate hours under what was current law. The first 2 weeks of the employee's emergency FMLA may consist of unpaid leave, but the employee may choose to substitute any accrued, unused vacation, PTO, or paid sick leave benefits for the unpaid leave. The remainder of the emergency FMLA pay must be provided by the employer. Therefore, a covered employer must provide at least 10 weeks of qualifying paid emergency FMLA to a covered employee. That remaining 10 weeks of paid leave must be at 2/3 of an employee's regular rate of pay of the last 6 months and reflect the number of hours an employee would otherwise be normally scheduled to work. The paid leave is capped, however, I should mention, at $200 per day and $10,000 in the aggregate. As it relates to emergency paid sick leave, beginning April 2nd, all employees are eligible for paid sick leave under the Emergency Paid Sick Leave Act, regardless of the length of time they've been employed. Employees are not required to first use other paid leave before using this under the Act. This leave is in addition to any paid sick leave, vacation, or PTO currently provided by employers. And under the bill, an eligible employee may take paid sick leave if they're unable to work for one of 6 reasons, which is outlined in the Act. There is a whole bunch more nuance to this that I could go through, but again, in the interest of time, I want to be able to get to everyone's questions. I will say that, importantly, the way that Congress has chosen to address this is that under the Act, employees will receive quarterly tax credits for providing this benefit for family leave, allowing credits against the employer's portion of Social Security taxes. And employers are entitled to credit for qualified family leave wages up to $200 per day for each individual and $10,000 total with respect to all calendar quarters. Fiona, I don't know if you're unmuted. I want to pause there because you are really the expert in understanding the implications for this bill and that, so I didn't know if there were some comments you'd like to make.
No, but I think specifics, and I know we can't get into all of that during this webinar. So I know you've got resources on the Maryland Chamber's website. My law firm, Shaw, shawe.com, also has a COVID resource page, and we have frequently asked questions that do go into very specific detail about all of the various new paid sick leave mandates under the Families First Coronavirus Response Act. So if you have specific questions about those details, I think it would be helpful for you all to take a look at those resources. I think a lot of your questions can be answered there.
Thanks, Fiona. So that again, as I mentioned, was signed into law last week. What we're dealing with this week is phase 3 of the congressional plan. It's a broader economic stimulus being referred to as the CARES Act. That stands for the Coronavirus Aid, Relief, and Economic Security Act, which was released by Senate Majority Leader Mitch McConnell, I guess late last week at this point. The days are all running together. And is really meant to serve as the broader economic stimulus package. This proposal addresses a lot of things. When it first was put out, it was looking like it would be something like just around $1 trillion in economic relief. Now, over time, that has evolved to something like $2 trillion in economic relief in any number of areas. And again, I'm going to run through these quickly, but there is lots more meat on this bone. These are very large, complex, nuanced proposals. So for more information, please refer to those resource pages that we mentioned. The CARES Act includes the following proposals. Now, this has not been finalized yet, so I caution you that this is, again, not something that's been signed into law or enacted. Negotiations are still ongoing. But it does include Small Business Paycheck Protection Program. This would be a new $349 billion Small Business Administration lending program modeled on the existing 7A program with a 100% government guarantee as opposed to a 75% guarantee for 7A loans that currently exist. The eligibility for receiving these loans under this legislation would be small businesses as defined by SBA standards, generally up to 500 employees, businesses in the accommodation and food service sector, and nonprofits with fewer than 500 employees who are 501c3s and do not receive Medicaid funding, as well as sole proprietorships, the self-employed and independent contractors. The maximum loans to be received would generally be monthly payroll costs for 2.5 months, not to exceed $10 million. Payroll costs would exclude compensation paid to individuals above $100,000 a year. As it relates to, in this specific provision, loan forgiveness, the borrower shall have a portion of their loan forgiven in the amount equal to their payroll costs, interest payments on mortgages, rent payments, and utility payments between February 15th and June 30th, 2020. Loan forgiveness will be reduced if the borrower reduces employment by a ratio similar to their reduction in employment. Other things contained within this proposal, there is a loan program and credit facility, $500 billion for loans and load subsidies that support Federal Reserve credit facilities. A number of business tax provisions relevant to our membership, including the delay of payment of employer payroll taxes, modifications for net operating losses. It accelerates the ability of companies to recover AMT credits, modifies the limitation of business interest. Let's see what else. There is a provision in here related to pension filings, banking relief. There is a component in here, as we've been hearing a lot in the press about payments and relief for individuals. Direct payments to taxpayers equal, in this version of the proposal, equal to $1,200 per individual or $2,400 for a joint return, plus $500 per child. This would be phased out for incomes above $75,000 or $150,000 joint. There is a provision in this proposal for pandemic unemployment assistance.
Ashley, we lost your sound.
Deanna, do you want to jump in?
I actually am not familiar with the details of the proposal before the House and the Senate right now, so I can't speak to phase 3.
Okay, perfect. Thank you. Let's just stand by for just a second.
Yep, I do believe Ashley was dialed in on 2 different lines, so hoping that she is grabbing her phone and she can hop back on here momentarily. Also, in case you didn't see my note in the chat, it appears as though some of you might be attempting to take notes. I know that we are covering a lot of information at a very fast pace. Please know that this call is being recorded and will be available to all of you in the next day or so that you can revisit the content and take notes when you listen a second time. And then also, if you check out our resources page on our website, mdchamber.org, you can also find a lot of this material there. Ashley, do we have you back?
So Marie, why don't we pivot to the next part of the agenda? And maybe Matt can begin to dig into what the state has passed.
Hi, I didn't have an actual presentation. I was just here to answer questions, try and help on any of the EOs that we've passed we've put forward so far, or guidance on some of the closures that we put forward. So I don't have a set up presentation, but I was happy to answer any questions that members might have.
So Matt, I can see that there is a question. And one of them is, can you give us a little bit more detail as to What are essential businesses versus non-essential businesses? Maybe some broad strokes on what the governor did yesterday.
Yeah, so we put out actually guidance on that. I know I've shared it with the chamber. I mean, basically it is pretty broad as far as what are essential. The main thrust of what we were trying to do with the executive order yesterday was to stop or to shut down businesses that had a significant amount of interaction with the public or required that more than 10 people would have to congregate in any one area, and social distancing was not available really. I will say, I don't know that you have enough time for me to go through every single essential business which is in our guidance, but I mean, you know, the chemical sector, commercial facilities, communication sector, manufacturing, defense industry, all of those are considered essential as long as they can comply with social distancing. Also, I know we've gotten a lot of questions from people about different service companies that can provide services without any direct contact with the public and things like that. Our executive orders were not to try and shut those essential businesses down if you can still provide those services without, you know, in face-to-face interaction, things like that. So we've got, since we put out that EO, we have given a significant amount of guidance to other businesses that were looking to stay open, who could social distance while providing that, could work from home, other things, but could provide their services without that that in face-to-face interaction. So, you know, I know that the chamber has this. I believe, I thought I saw it was on your website, I think. So I'd be happy to answer if anyone has any specific questions to their industry. I can certainly go through here and look for that. But.
So Matt, this is Fiona, and I just had a couple of suggestions. One is, if it's possible for people who have specific questions about their particular business, is the governor's office taking those questions and can provide guidance on whether or not they would meet the definition of an essential business? So if they were to reach you outside of this particular webinar?
Yes, absolutely. They can certainly feel free to contact me. I can give you my email. It is mat.palmer, Palmer, @maryland.gov. Feel free to email me any questions that you have. Be happy to aggregate it. One of the reasons why I wanted to be on the call was also to say that if you do have questions, also sending them to the chamber. I've been in contact with Ashley and Andrew on various number of questions that they've had in regards to our EOs. So I'd be very, very happy to triage all of those questions that you have and then get answers for you, either ones that I can answer or ones that I need to go out to our departments and get some guidance on. So.
And I think, Matt, that there were several points that I know that either our firm or the Maryland Chamber had asked of your office that would be really helpful for the listeners. One was that non-essential businesses are not required to shut down as long as they can telework. Is that correct? They have to be close to the general public, but it doesn't mean that they have to shut down entirely if the employees can telework.
Absolutely, absolutely. So, I mean, I think that was the point that I was trying to make earlier. Yes, even if you're non-essential, if you have, you know, back office things that you need to get done, if you have work that you can get done without, you just need to be able to shut down to the general public, being able to come in and interface with your employees, and also to make sure that you can provide significant distance, even if you do have to have some of your staff in an office, be able to make sure that you can provide a distance that would be required for social distancing and try to cut down on as many staff as you can to allow them to telework and other things. Just simply to cut down on the number of people on the roads, the number of people out and about.
Okay, so just to reiterate, those non-essential businesses that can provide delivery services or off-site services are not being required to shut down as long as they can comply with the social distancing protocol. Is that correct?
Absolutely.
Okay, thank you.
So there's another question here, Matt, about someone who is an AV service provider, a commercial AV installation company, when they're wondering, do they fall underneath construction?
So I would advise you for AV delivery. I mean, you're going to be, if you are providing those services, if you can do them remotely, I think that would be fine. If you're having to go into someone's home and make installations and things like that, that would be a problem. You know, what we're trying to do is to cut down, especially in that circumstance where you'd probably be going to multiple people's homes, and the ability for you to then you know, carry the virus from one house to another and other things like that. That would be a problem. Now, if you're providing services where you can, you know, if you can log into their system and fix their system remotely, I think that's okay. In an instance where it's say a brand new installation, a construction site where, you know, there's not going to be other people there while you're installing, I could see that being okay. However, the idea that you would go to a number of different people's houses and do installations and things like that, that is not going to be something that we would want you to be doing during this time.
Matt, I think there's some question about enforcement as well. People have reported that employees are already calling to complain about their employers not shutting down. And there is some confusion, of course, about, you know, what is an essential business or not. And also some concern about employees potentially being stopped when they're out and about on essential business. Can you provide any guidance on what employers should be doing with respect to those issues?
So I will say that I don't know a great deal about how the enforcement is being carried out. I do know that you're probably, you know, if you see large congregations of people, we are going to be, you know, out and about trying to move those people along, provide for social distancing. But I don't know of any instance where you're having police officers stop people who are driving down the street going to a business or anything like that. I'd be interested to hear from you. I don't think that we've given any guidance like that in regards to state police or now I will say county enforcement, the counties actually have a significant amount of leeway on how they enforce some of this as well. So just know that your county executive or the county government does have, many of them have instituted a state of emergency within the county itself, and that gives them a certain amount of leeway as well as to how they enforce this. So it may, while we are trying to coordinate with all the counties, they do have their own set of emergency powers as well. So just be mindful of that.
Great. I'm back. Can you all hear me?
Yes, Ashley, we can. Thank you.
Okay. Sorry about that. I am like everyone else working through technical difficulties, and in rural America, the internet is not always so secure. So we did have a backup plan, and I'm glad that Marie flagged that for me. And thank you, Matt and Christine, for hopping in. I'm not sure what the last thing that you all heard me say was. I'm assuming it was probably something having to do with the support that we're receiving at the state level. And so, I mean, I'm really close to sort of the end of my remarks here, and I do want to be able to
take questions from everyone. And so the last thing that I will say before we turn it over to that chat feature is that we do intend to continue these discussions throughout the coming weeks and months as the situation evolves. So today, we are announcing the formation of the Maryland Chamber of Commerce COVID-19 Working Group. And this group is going to be open to any member of the chamber that wants to volunteer. And our goal for this group is for it to be responsible for the following. One is to be able to convene a smaller subset of our members to provide weekly updates of what's transpiring at the state and federal level, aggregation of specific challenges as the situation evolves. And then lastly, and most importantly, the charge for this group is going to be developing policy recommendations for economic recovery in the near, mid, and long term. We really want to be able to leverage the expertise of our membership to be able to make those recommendations on an ongoing basis as we're asked. So if you do wish to participate in that effort, please contact me at Ashley Duckman, a.duckman@mdchamber.org. Please just shoot me an email. We will aggregate that list and we will start meeting weekly via conference call once we have that all locked in. So I am not actually able to see let me see if I can refresh this and see if I can see the questions.
So Ashley, I can see the questions.
Okay.
So I'll jump in here.
Okay, great. Thank you.
No problem. The next question in the chat feature, and maybe Matt or Fiona can help with this, is how is the governor handling independent living and assisted living facilities?
I will say we have put out some guidance on that. I don't have it in front of me. I can certainly pass that on to the chamber or send that directly to whoever had that question. I have to say I haven't read through that, but I know that we put out guidance from the Department of Health on how to move forward with that. I do know that we're obviously allowing them to stay open, and we're trying to give them as much support as we can. But I know as far as I know there's guidance. I can certainly get that to you.
Perfect, Matt. If you get that to us, we will post that on our resource page, which everyone should just stay tuned to because we're updating it on the hour. Okay. We have posted the Chamber's website address for the COVID page. And then we have extensive Small Business Administration resources there, letting folks know how to access the emergency support. And we will have posted, someone's asking, can you provide the links to the specific state acts regarding family leave? Those are posted there as well. And someone's asking if we could go back and just speak a little more, elaborate on the 2 weeks of paid leave, FMLA. I don't know, Fiona, if you could speak to that.
Yeah, I can speak to that. So there are two different components that Ashley covered in the Families First Coronavirus Response Act, the federal law that's supposed to take effect on April 2nd. We're waiting for regulations from the Secretary of Labor on how some of this is going to work. But generally speaking, all employers who have less than 500 employees will have to provide 2 weeks of paid leave. And that's going to be on top of any paid leave that you already provide. It will only be used for those COVID-related reasons that are listed in the law. There's 6 reasons. They're basically if an employee is subject to a quarantine or isolation order, if they are showing symptoms of COVID and seeking a diagnosis that, of course, they have COVID. If they're taking care of a family member who either has COVID or is under a quarantine or isolation order, or if the child's school is closed. And then there's some catch-all provision that the Secretary of Health can identify additional reasons that it might be used for. But basically, under those 6 reasons, you can take 2 weeks of paid leave. That is, again, on top of any paid leave requirement. And that includes Healthy Working Families Act leave that all the Maryland employers are subject to. and also the Montgomery County paid sick leave requirement that the employers in Montgomery County also have to comply with. And so that is only going to be through the end of this year. You will get a tax credit to fund that. And as Ashley said, there are different levels of reimbursement in terms of what you have to provide. So it's full pay up to $511 a day if it's for the employee's own reasons. It's $200 a day at 2/3 pay, up to a cap of $200 a day if it's for these other reasons, the family reasons. And then separately, the Family and Medical Leave Act has been amended to add a new reason. And again, it's COVID-related school closures or childcare closures. It is only through the end of this year. That piece of it will apply to all employers with fewer than 500 employees. Regular FMLA continues to apply. So the 12 weeks is not an additional 12 weeks for this reason, this school closure reason. It is using the available 12 weeks, or for those employers who are under 50, now it is a new bank of 12 weeks that are, specifically for this reason. And the first 2 weeks of that 12-week allotment under FMLA will be unpaid. And then the remaining, as long as it's for that school closure related to COVID, will be paid at 2/3 pay up to a cap of $200 a day. So the first 2 weeks that are unpaid, the individual can tap that other bank of paid leave that is provided for under this act, that leave, to cover that unpaid portion, and then the remainder is paid under FMLA, but only for school closures. I want to emphasize that because there's some confusion there. Only for school closures, okay? And then another piece of it that I've gotten a lot of questions about is it's not an automatic, the school is closed and therefore the employee gets a time off. They must be needed to care for the child whose school is closed or whose childcare is closed because of COVID-related reasons. So we do think that there is some ability on the part of the employer to ask why the employee is needed to care for the child. I mean, if I've got a teenage son who's sitting at home who doesn't talk to me anyway, clearly I don't need to care for him, as opposed to if I have a toddler who does need that level of care. So I think you can ask some reasonable questions about that, but I'd be really careful about pushing too hard because you could end up with a claim that you interfered with somebody's right to take the leave. So just be mindful that you aren't too aggressive when you're asking those questions, but we do think that you're entitled to ask at least some questions to establish that need for leave to care for the child.
Great, Fiona. Thank you so much. Here's another. Go ahead, Matt.
Go ahead. No, it's Ashley. I just wanted to, I am now able to see most of them. So but go ahead, Christina, if there are other questions that you can see that I hadn't already been addressed.
So the one other question that I was going to read is there is a sole proprietor on the call, and they're wondering if they can apply for unemployment from the last salary job. And if so, or if not, what coronavirus relief programs are there for sole proprietors with no employees? And Mary, you're going to find the details on the Chamber's webpage, which links to all of the FMLA rules. Fiona, do you have any specific knowledge about sole proprietors?
Not specifically as to this.
Okay.
This is Ashley. I would absolutely suggest visiting that Business Express webpage. In the second, it's either the second or third section of that page, you will see direction for businesses of all types, sole proprietorships and others, on how they can access unemployment insurance, how they can apply, what is needed. There are links to online resources. There is a hotline that you can call, and that's where you're going to get your best information. So visit that businessexpress.maryland.gov. Scroll down to the section on employee or employer assistance. I think it's the second or third one, and you should find everything you need there. Again, if there are specific things we can do after the fact, please reach out to us directly and we'll do our best to assist. Other questions via the chat? All right. Again, I want to say thank you to everyone who hopped onto the call. Very much appreciate. Apologize for my own technical difficulties as we all are trying to adjust to this new telework lifestyle. Again, I just want to stress that all of this information is contained on our website. You will be getting follow-up materials. We will continue to develop things in the coming days and weeks. Please reach out to us. Please let us know if we're missing something that you're aware of. We're just trying to be sort of that ground zero resource for the business community at this time. One last plug to reach out to us. If you would like to be part of this ongoing working group, we, again, like I said, will be starting to convene conference calls on a regular basis, and the topics will evolve as the situation evolves. And again, just reach out to us. We really want to know how we can help you. I see, let me just answer this one last question. Someone asked if there is a way to confirm whether a business is essential. I would say refer to that interpretive guidance document that I mentioned that is now on our website, but also businessexpress.maryland.gov. If that does not provide you the clarity that you need, I would email psector@maryland.gov, and Commerce should be able to get you some more clarity.
Actually, Ashley, I think while you were off, Matt Palmer also said that it could be emailed directly and can provide.
Okay, perfect.
Whether or not a business is essential.
Perfect,
again,
perfect.
That would be mat.palmer, P-A-L-M-E-R, @maryland.gov.
Great. Thank you. And thank you so much to Fiona and to Matt for joining us today. We very much appreciate it. And everyone, please stay safe.
Thank you.
Thank you.